Welcome to the International Federation of Rural Surgeons Patient Education videos. Today we're going to talk about urology nurse, how they can help you. Why are we discussing this? In any OPD, usually about 4 to 6% of the patients have urology problems. Then what about urologists? In India, we have one urologist per 5.64 lakh population. On the other hand, we have about 148 nurses per 1 lakh population. So obviously, it's very difficult to get hold of a urologist in India. While it's relatively much easier to get hold of a nurse, especially if you need emergency treatment. So how we can use them? As we said, emergencies, there is 1 out of almost 6 lakh population, there is a urologist. So it'll be very difficult to find a urologist who could handle an emergency. But most of the urology emergencies are fairly simple to manage. Very often it requires only putting in a catheter if there is a retention, or taking care of the catheter. And also quite a lot can be done by general doctors, especially if they're able to consult a specialist. So all these are possible by nurses who have special training in urology. And again, we said 5 to 7% of the patients in rural areas have urology symptoms. And to intelligently evaluate them, we need to do some urodynamic studies or special tests, and also do some specialized low-cost investigations. And a urology nurse who has an idea of how to do all these things is of immense help to the local doctor. They can comfortably do the urodynamic studies if they know how to do it. And they're also able to order the necessary lab tests. And now, thanks to the recent lockdown and innovations, Zoom consultations is becoming quite popular. Even in remote tribal areas, the patients are able to use the Zoom consultations. And this makes more sense because you don't have to be in direct contact with the doctor for more than 15 minutes. Because if you spend more than 15 minutes with somebody who's infected, there's more chance of getting the infection. So all the discussions and consultations is possible through Zoom. And in addition, the nurses can do quite a lot of health education and explanations. Very often, the doctor does not have enough time to sit and patiently explain everything to you. On the other hand, the urology nurse would be able to spend a lot of time with you and explain and make you understand. And the IFRS, International Federation of Rural Surgeons, have recently started a new course for general doctors, which is called Rural Urology Practice, which is a certificate course given by the Association of Rural Surgeons of India and IFRS. This will train the local doctors to do many of the procedures, which can be supervised through the Zoom meeting. And these can help to wisely treat about half the urology patients who present any of the rural outpatients. And they are directly supervised by the urologist. So nothing, it's in fact the patient gets the best which is possible. And very important to have a proper follow-up following many other urology procedures. For example, when you break a stone and put a double J stent, the traditional stents can't be kept for more than 3 months. Even the newer ones cannot be kept for more than 6 months. And the earlier we remove, the better, because it is a foreign body. So these urology nurses can help you decide when to remove the stents and whether it needs replacement or whether it can be removed. And these minor procedures, as we said earlier, can be done by the local doctors under supervision. And also they can give the follow-up medication. And then some procedures like self-calibration, they can supervise. So the urology nurses can be of immense help, especially in emergency situation or in the first line of consulting a urologist. So we have the contact information here for the nurse who trained in urology by the International Federation of Rural Surgeons. For any incident, contact Mr. Bragan. Thank you.